Do we have this pandemic under control?
Well, as far as under control, I would say no. And I won't say we have it under control until we start to see death rates go down, hospitalizations go down, and cases start to go down.
I want to ask you about hydroxychloroquine. We heard the president talk about that yesterday. He's really been pushing for this. Is there evidence in the medical community that hydroxychloroquine is proven to prevent or treat COVID-19?
There is not evidence that hydroxychloroquine has been proven to treat or prevent COVID-19. But the important thing to understand here is that 80% of people who go on a ventilator, at least by the New York City data, are not coming off of the ventilator. And so we want to give every person who gets diagnosed with COVID-19 the opportunity to have a conversation with their healthcare professional about different treatments that may limit their chances of needing to go on a ventilator and ultimately passing away.
You can look up some of the side effects of this, and some of them are dizziness, nausea, seizures. Those are bad side effects, right? Does that concern you that the president is, touting this as a potential solution for this problem right now, and there could be bad side effects for Americans?
One of the reasons many people are optimistic about hydroxychloroquine from a safety perspective is because we've been giving it for malaria, we've been giving it for rheumatological diseases for many decades. The most important thing, again, is to always talk to your healthcare provider and make sure for you that the risk and benefit ratio is something that you and your healthcare provider agree is in favor of taking this medication.
So don't necessarily listen to what the president is saying from the briefing room podium like yesterday.
The president has consistently said, we want to make this conversation happen in more places. We want more people to have the opportunity, if they're facing a life and death situation, to, from a compassionate use point of view, have every option on the table.
As America's top doctor, what would you say, though, to people?
As America's top doctor, I would say that we don't know for certain right now that this drug is efficacious. We also don't know that in higher doses, this drug is going to be as safe as we've seen it in the past. And so have a conversation with your healthcare provider.
You tweeted on February 1st, roses are red, violets are blue. The risk is low from coronavirus, but high from the flu. That has obviously changed. Then on February 29th, you said, seriously, people, stop buying masks. Do you regret posting those things?
I always, and we always, from a health perspective, try to give people the best available recommendations based on the information we have at the time. At the time I posted about the flu, we were in the midst of a terrible flu season, and every public health organization in the world was telling people, get your flu shot.
But we also knew at that point that this was really hitting China hard in January, and we already knew that the U.S. had a case by January 21st, I believe was the first case in the U.S., and we also knew that there was no vaccine.
Well, it's important to know that this isn't a competition, and as a matter of fact, one of the big concerns we have with COVID-19 is that many of our hospital beds were taken up by people who had flu and didn't get their vaccinations and actually ended up in the hospital.
Should Americans be wearing masks wherever they are going now in public?
It's a great question about masks. And originally, the CDC and my office recommended against the general public wearing face masks because the best available evidence at the time suggested that they had minimal impact on preventing the person wearing the mask from catching coronavirus. What's changed is that we found a significant number of people are spreading the disease before they're symptomatic or when they're asymptomatic. And so we've now recommended that people consider wearing a cloth face covering as a way of protecting their neighbor.
If we had been wearing those masks, say, at the end of February, beginning of March, would that have potentially curbed how many cases we're seeing in this country and how many deaths we're currently experiencing?
Well, no one can say. Hindsight is always 20/20, but the fact is that
you wish you'd made that guidance earlier, though?
Well, I think people forget that the context for my guidance originally, number one, was the best available science, but number two, there was a run on medical supplies and equipment at the time by the public. People were buying up and wearing N95 masks. So there is a very real chance that if more people had worn masks, it could have slowed the spread some, but there's also a very real chance that it would have put more healthcare providers in a situation where they didn't have that equipment.
There's been mixed signals, not only coming out of the CDC and some of the White House task force about things, but also from the president. Do his contradictory statements from the White House podium make it harder for you to do your job right now?
Well, I think in many cases, things are portrayed as conflict more so than what they actually are. What we've always said is that we are hopeful, we are aspirational.
You as the leading doctor in the country saying one thing, and then the president, you said yesterday that this is this country's 9/11 moment again. It's Pearl Harbor. And then President Trump is tweeting today it's a light at the end of the tunnel. How does that not make your job difficult?
Well, those were both true. 9/11, Pearl Harbor, they were terrible tragedies, terrible moments in our history, but they were also moments where the country came together, bonded, and came out stronger for it at the end. I'm hopeful that, well, not just hopeful, we absolutely need America to understand that even though this week is going to be tragic, the public has the power to change the trajectory of this epidemic.